Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here, right now, 866-870-5752, right here in the studio, and you get a free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What do you think, Dr. Darrow?
I think I'm living it up and having a great time, and this is an interesting question I have, which I'll get to in a second.
Okay.
First of all, what we do is we regenerate tissue that's worn down or injured. So it can be arthritis, it can be meniscal tears in the knee, arthritis in the toes, it can be neck pain, back pain, shoulders, hips. We get tons of, I think the order of the number of things we get is knees are number 1, shoulders 2, low back's number 3. But we do the whole body. There's really nowhere that we don't inject for musculoskeletal orthopedic issues. So I'm going to go over this one because it shows how important it is to actually touch the body, which is one of the great themes of the show that you need to talk to your doctor about. If a doctor does an image of your body and says you need a surgery based on that image, and this is for orthopedics I'm talking about. It's not if they find a cancer or something like that, God forbid. But if it's in the musculoskeletal system, make sure they touch the area to find out if what they see in the image is similar to what they find when they touch the area, because it can be totally different. So this one says, this question says, and by the way, you can go to my website and email me any time of day or night, and I will answer all of your emails. And to get to the email spot on the website, which is on every page, just go to the website at www.jointrehab.com. And I've made it very convenient for people to get a hold of me that way. So this one says shoulder tendons, okay? And what the person did is they sent me the language on their MRI, okay? That's all they did. They didn't say a thing about the shoulder. They just wrote out or copied and pasted their MRI report into my website and sent it to me. And I get these all day long from all over the world. They're all answered, so yours will be answered too if you contact me that way. So I'm going to read part of it, okay? It says, osteoarthritic changes of the acromioclavicular articulation with evident supraspinatus tendon, bright signal within its substance, and diffuse swelling at its osseous attachment. Type 2 acromial process showing lateral down sloping. Now, this is just about 1/10 of what this report says. I'm not even going to read the rest of it to you because it's nonsense, okay? That doesn't mean I don't ask for people to get MRIs, because I like to use them as a backup for what I find with my hands. And Dr. Grove does the same thing that I do. We're trained in a similar manner of using our hands to diagnose. Old school, right? Well, it's not old. It was old school before there were images, but any smart doc is going to do that. You don't trust the MRIs. So with this long MRI that has been, a wonderful radiologist read the image, does this help me tell you what's going on? Most of the time it does not. Sometimes it does, because what's going on may not really be what you see on an MRI. So, first of all, this says osteoarthritic changes in the acromioclavicular articulation. Okay? That's this teeny little joint, the AC joint, that often doesn't cause any pain no matter how much it's arthritic. It could, but most of the time it doesn't. How do I know? Because I examine the shoulder when I see this on an MRI, and I move it around. I try to stress that joint. I press on it and see if there's pain. Most of the time there is not. Too many of my patients have come in after a surgery where they actually cut that joint out. That's crazy to me. They cut it out and they have worse pain afterwards. It's a bad surgery. I don't know why it's done, in my humble opinion. You go to a surgeon, they may have their humble opinion too. It could be conflicting. We don't all have to get along. So then it says evidence supraspinatus tendon bright signal. Okay? Well, does that mean the person has supraspinatus pain or that the supraspinatus tendon is causing them pain? No. How do I know that personally? Because I have had an MRI of my shoulder from years ago showing a supraspinatus tear, showing a subscapularis tear, showing a labral tear in my right shoulder. Well, guess what I did? I injected it with regenerative medicine, and I have no pain. Here I am flailing my arm up in the air in front of the camera. You can see it doesn't hurt. It did hurt, but it wasn't those things that caused the problem. So people say, what was it? And I will have to answer, I honestly don't know specifically. I know the areas that hurt because I touched them and I injected those. But it's not that simple. It's just medicine is not that easy. And make sure your doctor does examinations on you by touching and motion, moving you around. A real examination and a good history to see what happened before they ever consider injecting you or operating on you. Please do that. You'll save yourself from needless procedures. And what just popped into my mind when I said the word injecting you is be careful not to get steroid shots. Steroid, sometimes it's called cortisone or prednisone or dexamethasone. A lot of names. The ONE at the end means steroid. So be careful of that. Like testosterone, ONE, that's a steroid. Progesterone, that's a steroid. Okay? That's different, though. That's not for orthopedic issues. But if you're getting a cortisone injection into a joint, I promise you, you are going to wear down some of that cartilage. It softens the tissue. If it's weight-bearing, it's really going to wear it down. Do these injections make you feel good? They make you feel great. You know, you mix some lidocaine, a local anesthetic in it, and you put a steroid in it, and the local anesthetic will make it numb. Of course it feels great. And then the steroid starts to kick in over the next day or two, and it feels amazing. It's a very strong anti-inflammatory. But in the long run, you'll be sorry you did it. We use it very, very, very sparingly in our clinic. There are very, very few cases we'll use a steroid injection. Sometimes I will use it if a person comes in with back pain, low back pain or neck pain, where they basically cannot move, where they've been seized up from a ligament sprain. Now, they may have something like a herniated disc, but that's not the pain generator. So be careful. You're going to end up, if you have pain, getting a lot of weird, different diagnoses based on the images that are not necessarily the cause of your pain. Find somebody who can figure out what the cause of the pain is. All right, Nita, I'm going to mention a couple other things here. One is
phone number?
One is the vampire facelift.
Oh, right.
And that is injections of platelets or stem cells into the face to regrow the collagen and make you look younger again. The other is for people who have thinning hair. These injections on the top of the head can re-stimulate the hair follicles and grow your hair back. It's not going to be very worthy of you if you don't have any hair to grow a little bit. It's better for people that are just thinning and filling in the blanks. And yes, I will give out the phone number so you can talk to us live right now. And that number is 866-870-5752. Please call in. If you do, I'm going to send you, and I'll pay the postage, a copy of this hefty book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There's great photographs of how these injections are done, and a lot of different athletes getting these injections, and it's got all the science behind it. Here's a photograph of a knee replacement, and I'm telling you, if you ever watched a knee replacement, you wouldn't want one. It's pretty brutal, and there's a friend of mine as an example who is a retired police officer, 35 years on the force, and he had a knee replacement, I think about a year ago now, and I just talked to him a couple of days ago, and I said, how's that knee doing? And he said, well, it's not that great. It's still very, very painful. He said it might be a little bit better, but it's not great. And I remember after he had the surgery, he lost all of his range of motion in that knee for quite some time, and he had to work out with physical therapists quite a bit to get some range of motion back, but it still isn't any good. I know there's a lot of people that get these joint replacements who do very well. I'm not putting it down like that. I'm just saying there's a high failure rate also. And I've seen the worst of it because I get the failures. They come to me afterwards, and most of the time with the joint replacement, there's not much that Dr. Grove or I can do to help you, because you have materials that are put in that are not biological, where we can't stimulate tissue to repair. It's metal or plastic. Sometimes we can. There can be supporting structures around that joint replacement. There can be tendons. There can be ligaments that we can inject. Sometimes we'll just see fluid around there with the ultrasound. We can look inside and aspirate that. There are some things that we can do even if there is a joint replacement, but the joint itself is what it is. And unfortunately, many joint replacements wear out over time. And, if you're super active, if you're a great athlete and you get a joint replacement, you continue to do the same thing, you're not going to have that last very long, because the bone will wear out. And then there's a space between the joint and the bone, and you have to have a bigger replacement put in. And when that's done, sometimes they'll actually crack the bone, and that can be a really severe problem. So you have to be very, very careful about that also. So we're getting a caller in here. Let's see if we can grab that one, Suzette, before I go on to another question. So we don't have a name yet. I love getting the name. Come on, Suzette, go for it.
Well, we could give the phone number again.
Yeah, let's give the phone number, get some more callers. Talk to us live right now. The phone number is 866-870-5752. We're going to go to George in Altadena. George, I'm glad you called. This is Dr. Marc Darrow. And
yes,
good. You have something going on with your hips. What is it?
Yes, my hips. Since my wife passed away about 8 years ago, I got a lot of hip joint pain, and I losing my range of motion. I don't know if your stem cell thing would work.
Okay. What did your doctor tell you?
I don't really go to doctors.
Okay. I did go years ago, they didn't do nothing. Oh, just kind of exercise, and they gave me some exercises to do. Okay.
That was it.
So did they do an image or give you a diagnosis or touch your hips to find out what's going on?
No, they did not.
Okay.
I didn't get anything.
Okay, well, that's fine. Are you having any pain?
Yeah, it's always pain. I mean, I can walk. I can walk, straight and everything. But let's say I'm going to put my socks on or something, and I can't. My range of motion on if I spread my legs, it starts hurting.
Okay. May I ask you, George, how old you are?
I'm 66.
And were you an athlete when you were younger?
Yeah, I used to lift weights and everything, and I can still do that, but my upper body is still, but.
Okay.
So, I'm okay overall.
Okay. Well, I've got a great story for you. I had an older, I don't know what age he was because it's a long time ago. He was a bodybuilder from Italy, and he came in for his hip, and his main issue was he couldn't bend over to pick up the weights. Okay. And he did have pretty severe arthritis in that hip. He could barely move the joint. So
Right.
I actually said to him, "You need to get a hip replacement because I can't help you with that hip. It's so arthritic." I don't often tell people that, but occasionally I do. And he said, "Okay, can you work on my knee? I've got arthritis in my knee." And I examined his knee, and it was pretty good. He had some problems, but it was pretty good. And I said, "Fine, we'll work on your knee." So we did stem cells on his knee, and he got better with that. And he came back, and he said, "That was pretty amazing. My knee is so much better. Would you please, please, please put some stem cells in my hip?" And I said, "I don't want to waste your money and do something that I don't think is going to work." And he literally begged me to do it. He said, "It's been such a miracle in my knee. I just want to try it on my hip." He says, "I don't need to get it 100%. I just needed to get it enough so I can bend over to pick up weights because my life is all about bodybuilding." He was really in great shape, too. So I acquiesced. We did it. And he came back a couple weeks later and he said, "It did the job." He said, He said, "I don't have great range of motion, but it gave me enough so I can bend over to pick up the weights."
Yeah, right.
So,
wow. Yeah, all my joints, none of my joints hurt. My fingers, my wrist, everything. My knees don't even hurt. I just that range of motion on my hips.
Yeah.
Kind of spread my legs or something.
Sure. So I generally tell people when they ask me, will it increase my range of motion? And the answer is typically not, unless you do a lot of the treatments. Because one treatment typically is not going to grow enough cartilage that you'll know the difference. But in this particular Italian weightlifter, I think it was more that the inflammation that the injections cause and the white blood cells that come to the area digested away some of the debris in that joint so that it gave him more range of motion. It wasn't necessarily the tissue growth.
All I need is about an inch. That's all I want. It's more range of motion, and I'll be happy with this.
Well, why don't you come in? Let me examine you. The phone number to the office is 800-300.
Hang on for just a minute.
Sure.
1-800. Oh, wait, hold on.
Let me say the whole thing at one time. You ready? It's 1-800-300-9300. And you can call there right now or after the show. There's people there waiting for your call. And we're going to send you out a free copy of my book, Stem Cell and Platelet Therapy. Regenerate, don't operate. I'll pay the postage on it. You can read all about this. And you can also read about this and watch me doing stem cell injections in the hip right on my website. There's videos of me doing it. And that's www.jointrehab.com.
Rehab.com. Okay,
Yeah.
Okay, I'll definitely look at that.
So there's hope for you, but I'm not going to know anything for sure unless I examine you. You sound like you're not too bad off. And to get you another range of motion, another inch of range of motion, that's very, very feasible if that's all you need.
Oh, yeah, that'd be perfect. Like I said, I can walk. I walk. I can walk all day. I mean, nothing bothers me. Just that range of motion.
I hear you.
I forgot to tell. I did have a motorcycle accident in 2011, and it took me about 8 months to recover. I've no broken bones or anything. But
okay, well, good for you, man. You sound like you're in great shape. I always think that people are active have a better life, and I think my life is amazing because of my ability to exercise. I mean, I have a lot of great things in my life, but I'm blessed to have a body that works. I often injure myself, but I'm lucky to be in the profession I am because I just inject myself. I inject myself and fix it. All right, George, we're going to go to Mark in Simi Valley, and God bless you, George. I appreciate you calling in. So, Mark, my name is Mark too. This Dr. Marc Darrow.
Like this. Yes.
And I understand that you're having Yep. Can you hear me?
Yes, sir.
Okay. So I understand you're having. I understand you're having knee issues. What's going on?
So I've never called into a show like this. I've listened to you for a long time, but I've never really thought it applied to me.
Yeah.
And I had a construction accident a couple years ago, injured my left knee. And went and had an MRI, X-rays, et cetera. Doctor said my left knee is full of arthritis, and I have 80% reduction, 85% reduction in my joint space.
Okay.
So I've been in a lot of pain.
Okay.
I mean, even just resting, like a knife stabbing in my knee.
Okay.
So Christmas Day, my son gives me some turmeric. I took this, and it was overnight. Amazing reduction in swelling. I want to know.
Oh my God, that's so great. Well, the next step is to take as many steps as you can. It sounds like you're good.
That. I'm very active. I'm in the gym 6 days a week. I hike, surf. I mean, what I can't do is run. I want to play basketball again.
Okay.
And that's what I want to do. So,
okay.
I just want to. I mean, should I try stem cell therapy?
Well, I haven't examined you yet, so I can't tell you what's going on.
Of course.
So you are the prime example of a mistake in medicine, okay?
Cool.
And the reason is because your surgeon was telling you how bad your knee is, implying you need a joint replacement. I don't know if he ever told you that. Did he ever tell you?
Yes, he did say that.
Okay.
Absolutely.
But here you are. You took some turmeric and you're fine.
Well,
so the question is,
I'm not going to say I'm fine. I mean,
well, you're fine compared to getting a knee replacement.
Right.
You know, you're not 100%, but did you need a knee replacement?
Right. He said I would need one, and I was just trying to reduce the swelling and the stiffness. I could barely walk, doctor. I could barely walk, and they said that's
no, you could barely walk before. Can you walk now?
Yes, sir.
Okay.
Quite well. I mean, after 1 week of this.
Yeah. So that shows you that the arthritis is not a big problem for you. And that's what I preach on the show. I preach it every show. Having arthritis does not equal having pain or limitation. It can, but it might not. I see patients every day who have what is called advanced arthritis or bone on bone, and they don't have a problem anymore. So don't get lost in images or someone who tells you need a surgery when all you did is took turmeric and it got you. What percent better are you with the turmeric? Make it up. 50%?
I'm sure it's 60% better.
Okay.
In overnight, in 24 hours.
Yeah, and that's not uncommon. And we find that all the time with people who try supplements like that. There's a lot of different anti-inflammatory supplements that are natural. I wouldn't go to things like ibuprofen. They're not good for your kidney or your liver, and they actually block healing. They block the regeneration of tissue because the body with inflammation is trying to heal itself, believe it or not.
Right.
So
that's what I'm looking for next is how can I restore some cartilage?
Call the office, 800-300-9300. I can't wait to see and get you all better.
Thank you for your call, Mark.
Thank you, Mark. God bless you. God bless you, Anita, Suzette, Alex, and the rest of the crew. It's been a great day and a great show, and we love you all.
We do. And listen to The Pet Show with our pal Warren Eckstein, 11-1 every Saturday, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab experts for free and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.